Go.
Hi, my name is Sheila, and my patient here is Sherry, and my lovely assistant, whom is my daughter as well, is Sydney. Say hi. I'm here to test Sherry's neurological system, and the first thing we're going to check are her cranial nerves, in which there are 12. The first cranial nerve we're going to check is cranial number 1, which is her olfactory sense of smell. Thank you, Sydney. Sherry, I'm going to have you close your eyes. If you can plug one nostril for me. Can you tell me what you smell?
Coffee.
Great. And again, keep your eyes closed. What do you smell?
Vanilla.
Great. Her sense of smell is intact. The next thing we're going to check is our cranial nerves number 3, 4, and 6, which is the oculomotor, abducens, and trochlear. To do this, Sherry, I'm going to have you look at my light, and I want you to follow it. And then we're going to check the 6 cardinal signs of gaze. Follow my light. Great. I want you to follow my pen all the way in. And all the way out. We have good constriction with that. I'm going to shine a light into your eye. I can see that her pupils are equally round. They're about 3 millimeters in size, and they are symmetrical. And we'll just look straight ahead. We have brisk constriction, the right and the left. The next thing we're going to check is her cranial nerve number 5, which is the trigeminal nerve. And to do this, I'm going to have you clench down your teeth. I'm going to feel for her temporal and masseter muscles. They're equal and they are bilateral in strength. And also I'm going to pull down on your chin, clench your teeth. I should not be able to open her jaw, which I cannot. We're going to check her sense of touch. You can tell me if this is sharp or dull.
Dull. Dull. Dull. Dull. Dull. Dull.
Great. And this cranial nerve is indeed intact as well. The next nerve we have is cranial number 7, and this is our facial nerve. I'm going to have you do a variety of things for me, and we're going to look for symmetry. You can smile, and can you frown? You can close your eyes tightly, and I'm going to try to lift them, which I cannot, and that is a normal sign. Can you lift your eyebrows for me? Great. Thank you. And then the last thing to test this nerve, I'm going to have her puff out on, make puffy cheeks. Good. And I am going to touch her cheeks. And she has air that comes out, which is a normal result of this cranial nerve. The next nerve we're going to do is cranial nerve number 8, which is her acoustic. We're going to test her hearing. I can just tell with normal conversation that her hearing is intact. When I ask her questions, she responds appropriately. I'm going to do what's called a whisper test. So I'm going to plug one of her ears. On the other side, I'm going to stand 1 to 2 feet away. And Sherry, I'm going to whisper three symbols to you, and I want you to repeat them after I'm done, okay?
5V6.
And that cranial nerve is intact as well. The next cranial nerve we're going to do is number 9 and 10. This is our glossopharyngeal and our vagus nerve. And to use this, we are going to use, I can have that, Sydney, thank you. This is our tongue blade. I'm going to look at her uvula. I'm going to look for that it's midline and that it does rise. So you can stick your tongue out for me and open. Say ah.
Ah.
And the uvula is midline and it does rise as well. The next we're going to check is her gag reflex. So again, I want you to stick out your tongue. And she has a gag reflex, which I'm sure she enjoyed very much. The next cranial nerve is cranial nerve number 11, and this is our spinal nerve. Thank you, Sydney. And with this, I am going to look at her sternomastoid and her trapezius muscles. They are symmetrical. I'm going to hold my hand up, and I want you to turn your head into my hand for resistance. Rotate your head into my hand. Good. And the other way. Good. And I want you to shrug your shoulders against resistance. Good. They're equally strong bilaterally, and her shoulders, again, are equally strong bilaterally. The last nerve we're going to check is cranial nerve number 12, and this is our hypoglossal nerve. To test for this, I'm going to have you stick out your tongue. The tongue is straight. It's free of tremors. And I want to have you say 3 words for me. Light, tight, and dynamite.
Light, tight, and dynamite.
And this tests her lingual speech, which is intact as well. So as we can see, Sherry's cranial nerves are all intact. The next thing, as part of our neurological assessment, is to test her deep tendon reflexes. If I can have the hammer, thank you. First ones we're going to check are her biceps. To do this, I'm going to have you rest your arm into mine. I'm going to put my thumb over her bicep tendon. And I felt the reflex on that. And then we're going to do the next one. Relax your arm. And again, those both are intact. The next is the tricep tendon. I'm going to have you hold your arm out, let it go dead. Okay, we have good extension with that hand. Let your arm go dead. And we have good extension with that hand. We're going to also check her patellar tendon. I'm just going to have you sit up straight, keep your knees bent. I want you to cross your arms for me and pull. Okay, those are 2+. And then the next one. Good. The last tendon is the Achilles tendon. To do this, I have her knees bent, externally rotate her hips, and I'm going to dorsiflex her foot. Okay, and I felt that reflex. And again, with the other leg, just let your leg go limp. And I felt that as well. Her deep tendon reflexes are intact and no problems with those. The next thing we're going to check is her superficial reflexes, and by that we're going to check for the Babinski. To do this, I'm going to have to remove your sock. And to test for this, I'm going to stroke up the lateral side of her foot and across, and there is no response, which is normal in an adult. The next thing we're going to check is her muscle strength, and we're going to do the upper extremities first. Sherry, I'm going to have you squeeze my hands for me as tight as you can, push against me, and pull away from me. In her lower extremities, push against my hands, pull up. Good. She has nice, strong reflexes in her upper and lower extremities as well. And the next thing we're going to do is her sensation. I want you to tell me if this is sharp or dull.
Sharp. Sharp. Dull. 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 Sharp. Dull.
Great. Her sensation is intact as well. And Sherry, the last thing I'm going to have you do, I want you to stand up. And if you can walk over to the counter for me and walk back, we are going to assess her gait. And we see that she has a stable gait. And no issues of a fall risk. This concludes the neurological assessment for my patient Sherry. Thank you.